My name is Jennifer Horn. I am the Business, Economics, and Government Information Librarian here at UK. And you may be wondering why they have brought me in to talk about public health statistics. The first answer is that most public health statistics are government information, right? And secondly, because I have before I became a librarian, I had a 20-year career doing public policy research. And when you work in the public policy field, you don't necessarily have access to all the expensive journals, databases that UK offers. So we were able to do all of our research using government and other freely available sites. And so that's mostly what I'm going to talk to you today about, although there are a couple of UK provided databases that I will mention briefly at the end. So today I'm going to be talking about how to find public health data and statistics. I think you'll find that it can be challenging in that you may find way too much information or you may find not enough. And so I'm going to share my screen now and talk a little bit about what kinds of things you should consider when you're trying to identify a public health resource, and also some of the major sources of that information. So I'm going to go ahead and share my screen. And, oh, hold on, I've lost my, my PowerPoint. I'm going to, hold on, let me grab my PowerPoint. I must have closed it. Okay. Well, with that auspicious beginning, I'll go ahead and get started here. All right, so my contact information. I think one of the most important things you need to do when you're starting to figure out like the type of data that is going to meet your research need is you first need to really identify what is your focus or your unit of analysis. You know, are you interested in looking at particular populations like mothers, children, the elderly, Native Americans? Are you looking for data on a specific disease, like diabetes or cancer? Are you looking for a specific geographic area? You know, are you interested in global, national, state, county, regional level data? Are you looking for certain years? You know, are you looking for historical data or more current data? Thinking through all of this stuff at the beginning will help you try to identify the data you need and help you figure out where the best source of that data is. You know, first thing is like, what's the type of data? Are you looking for numerical statistics like prevalence rates or mortality rates, other indicators? Or do you need a complete data set? Like you're gonna do an independent analysis on a large data set. Or are you looking more for charts and figures or other data visualizations to, you know, for a presentation or for a research paper? Identifying the type of data you need will help you figure out where to look for it. You know, just, you know, when you're thinking about the types of health data, you know, you're looking at things like population surveys where they survey a population of people about their health conditions and behaviors. You've got provider surveys where you're doing surveys of medical doctors or medical facilities. You're looking at vital statistics like births and deaths. And you're looking for registries of diseases, so like how many people have been diagnosed with certain diseases. And all of these things, you know, play into trying to identify what type of data you're looking for. So as I mentioned earlier, you could be looking for based on geography, you could be looking for specific populations or specific diseases. You also need to take into consideration the need for timeliness and currency. And it's really important to note that data collection and dissemination takes a lot of time and a lot of resources, and that there's often quite a long lag time between the collection of the data and the availability to the researchers or the public. And real-time data is often difficult. Now, you're most likely to find current data, like real-time data on things like infectious diseases. As you're seeing, we're getting a lot of, you know, daily updates for coronavirus infections and things like that. But anything that involves a survey, like a behavioral survey of a large population of people, that's just going to take a long time to conduct to collect it, to aggregate it, and to make it available to the public. So if you see, a government report that has data from 2018 and you think, oh my gosh, this is too old, it's not current, like really, that's pretty current. That might be the most current you're going to find. And sometimes you're going to find even older data and you're going to think it's crazy that it hasn't been updated more recently. I think the most important thing when you're trying to find public health statistics is to think about who are the major stakeholders. Like, who is going to be responsible for collecting this data? Who is the most interested? And sometimes it's good to think about who can compel submission of the data. Like, not just anybody can require a doctor's office to give them statistics on the number of diagnoses, for example. Pretty much only the government can. And so for that reason, the people with the amount of resources and the interest in collecting the data and the ability to compel people to submit it is almost always a government entity. And that can be federal, state, city, or a large international organization. Sometimes you've got, large non-governmental organizations or nonprofits working in this field, but they're generally not collecting a lot of public health statistics firsthand. Although some of them do, but it's usually going to be a government agency. And government agencies also have the imperative to publish these health statistics to inform the public. And so they make it pretty easy to see their data. There's usually a section on a website for data, reports, publications, and they try to make it, pretty easy for a regular person to use, or in addition to having large data sets for researchers that might be harder, to kind of figure out. And when you're trying to figure out what kind of agencies or organizations might be collecting the data you want, I'm not going to tell you that a Google search can't be a really easy way to see who may be collecting this data. Because if you were to type in, cancer statistics US, it's going to take you to the National Cancer Institute. It will show you pretty clearly who is collecting statistics on what you're looking for. Alternatively, you could start with some of the major sources of information and data, like for global health, like the World Health Organization, or in the US, the National Center for Health Statistics at the CDC. And we're going to talk a little bit more about those in a minute. Another good way to think about who are the potential sources is, where are other researchers getting their data? Like, if you did a literature search, if you did a search of the health literature on your topic and looked at the citations, what data are they using? And then you can always go check to see if there's been an update to the data since that article was published. Another good way to do it is, what data is the news using, especially if it's something contemporary. One example might be that, right now, for multiple reasons, the data on coronavirus is not necessarily coming from the CDC, and the news is generally using other sources like the Johns Hopkins Coronavirus Resource Center as their source. It might show you who is really considered, one of the leading providers of the data in this field, to see who the news is using. And I think this is one of the most important things that I'll be telling you about today, but when you start looking for health statistics, you're going to quickly find that the same governmental sources appear over and over and over again. And that's simply because, like I mentioned earlier, that very few organizations have the resources to compile the data or to compel compliance. There's not necessarily a lot of money to be made in keeping track of a lot of these public health variables and statistics. So you're going to find lots of other people who are providing information on public health statistics. And what they're doing is they're aggregating the data. They're adding value with things like dashboards that make it easier to find information and visualize it. And I just want to say that that is not unimportant. It is a very important and useful service that these groups are providing. It takes a lot of money and time and expertise. But when you get down and look at the sources of their data, you are going to find that it is largely coming from the same either international or national government agencies. So once you start looking, you'll find the data presented in different ways from different groups, but you'll ultimately find that the source of the statistics is the same data. And you'll find that out pretty quickly when you get in the habit of looking at who they're citing and who they cite as the source. And so I just want to, kind of go through some of the major sources of statistics, starting at the national level. In the US, I mean, I don't think any of these are really going to be a surprise to a lot of you, but, at the top of the list, you've got the Centers for Disease Control and their National Center for Health Statistics, Agency for Healthcare and Research, also at the Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, and of course, the Census. So I'm just going to quickly show some of these and some of their major publications or data sets. And I'm going to toggle between my PowerPoint and the internet, so I apologize if it's a little clunky. But first of all, when you're talking about the National Center for Health Statistics, this is a really great place to start. This is a clearinghouse for pretty much all of the US health statistics, and they have it in ways that are pretty easy to understand. And their primary data collection systems include population surveys. An example of that is the National Health and Nutrition Examination Survey. They do provider surveys of medical facilities and doctors. So you've got things like the National Ambulatory Medical Care Survey. And then they do vital records. So you've got things like the National Death Index and birth registries, cause of death. And so I'm going to quickly, let's see here. Let me get over here. Okay. So this is the main page for the National Center for Health Statistics, and you'll see that they, we talked about it earlier, these are the different data collection systems they have. They've got population surveys, vital records, provider surveys. And if you were to click on population surveys, you'd get more information on what they're doing in them. So, I talked about this National Health and Nutrition Examination Survey, and they're doing, personal interviews, physical examinations, and this is what they're trying to find out. So you can, really kind of get in here to see what are the surveys. It might give you, spark some ideas about potential sources for data. You've also got, you can go and see they've got the vital records. So they've got things like National Death Index, National Vital Statistics System, provider surveys, again, asking doctors or medical facilities. And then they've got some historical surveys if you were doing more historical research. You can also see, they make it pretty easy if you wanted to browse by topic. One thing that I always tell people, if you're doing research for for a paper, if you get to choose a topic, for example, you want to make sure you choose something where there's data available, because if you pick something and there's not data, you're not going to get very far very fast, unless you have the ability to collect it. So sometimes it's interesting just to browse the available data sets and see what kind of things are being collected, and it might spark an idea. You can see that they've got these different topics. So if we were to go to these fast stats, this is their kind of quick statistics, and we were just to pick diabetes, for example, you could see that these are the type of statistics they have here. And the best part is that they give you the source and they give you the table number. So you can go directly to this particular report. You could go to this particular survey that they did. When you're talking about number of deaths, they're pointing you directly to the National Vital Statistics System. And then you can see that they've got all of these other, more data. So these are all the different surveys or other reports they have on this topic. And it's a pretty easy to understand language. You can also, we did topics, and so then you can also look at data and tools. And so CDC Wonder. This is their database that allows you to access all of their individual data. And it's pretty easy to use. They do have some directions on, frequently asked questions and how to use it. But again, you can also do it by topics. And you could look at, so like here, we'll look at HIV/AIDS data and and this is just like, so you go through and say, what kind of data do you want and how do you want to see it? Do you want charts, maps, tables? So you can really, kind of put together the type of data that you want. So again, it's a pretty easy way. They give you the different variables that you can choose from. There's also an A to Z index, so you can really, if you really want to get in the weeds, to look at, the types of things and where they're coming from. This is just a great place. You can see why this is a great place to start the National Center for Health Statistics, because they have everything in here. If you're looking at the national level, they also have a lot of state level in here, and so if you can see that you can really get in here and look. I don't know. Let's see. I can try to find a state one, but you can see, stat of the states is right here. Stats of the states. So you can see that you can go ahead and pick a state and you can get some key health indicators and other data. And the best part is that, again, it links you directly to source material. You can see they're telling you exactly where things are coming from. So there is a lot of state information in here. You can definitely, this would be a perfectly great place to start for state information, because most of the information in the health statistics can be broken down at a state level. And when you look at state level data from other places, this is where it's coming from. States are not necessarily conducting a whole lot of these surveys on their own. So it's just they're taking the Kentucky parts of it and putting it together. But yeah, so there's just lots of information in here. You can look at their, if you look at resources for researchers, they talk about the different data sets. You can also see resources for students and librarians, which might be in plainer English than what they have for researchers. Same thing with the general public. Government agencies have a responsibility to share their information with the citizens, and so they I think do a really good job of explaining what these surveys are and what they're collecting, in addition to providing data sets for people to do really kind of advanced research. One other thing that's kind of cool is they've got these data visualizations that are just different ways to kind of look at the data. And sometimes it's just, I always find that it's fascinating when you can look at a map like this and try to figure out why is this stretch from Louisiana to Indiana have the lower life expectancy than anywhere else in the country. So it's just some kind of cool visualization tools there. Let me go back to, let's see. And the one last thing I did not mention, and I'm not sure that, let's see, I'm gonna click on this just because this is their flagship publication, Health, United States. And this is an annual report on the trends in health statistics. And as you can see, 2018 is the most current. I warned you that the government publications are not, you might be frustrated that they're not more current, but I would imagine, we could look to see exactly when 2018 came out, which would give you an idea of when to expect 2019. But this is just a really comprehensive overview of the trends that they've identified from statistics. And you can, let's say you can see the highlights, asthma, diabetes, tobacco, obesity, just are things going up or down? Are they heading in the right direction or the wrong direction? And then they've got lots of charts and data sources that, this is pretty easy to read. This would be a great place, to kind of get yourself oriented to the types of statistics they collect. but this is their flagship publication. I showed you the fast stats. That was just the page with the different little topics. CDC Wonder was the database, and I showed you the data visualization gallery. But here you have all the links that I showed you in one page. The next one is the Agency for Healthcare Research and Quality. You may not have heard of this one as much unless you're in the healthcare field right now, because they are dedicated to making healthcare higher quality, safer, more efficient, more effective. They work with doctors and medical facilities. They collect a lot of information. And one of their flagship reports is this National Healthcare Quality and Disparities Report, where they really do a comprehensive overview of the quality of the healthcare received by the general population, and then also the disparities in care that are experienced by different racial and socioeconomic groups. So this is an annual report, and you can see once again that this is from 2018. And it's a very comprehensive thing about access to care, quality trends. And so this is a source that a lot of people refer to. But on this website, you can also see that they've got lots of different data sources. Pretty much whenever you go to a government or even like a organization, like you're looking for a tab that says data or a tab that says research, publications, that's where they're going to be sharing things. So you can, you could really get into like what are their fact sheets about, medical errors, minority health, primary care. So, this AHRQ is really the agency that is focused on the care people receive. All right. Another one within Health and Human Services is the SAMHSA, which is the Substance Abuse and Mental Health Services. Obviously, they are involved in substance abuse and mental health services. But you can see like two of their major surveys here are a national survey on drug use and health, and also a national mental health services survey. You can go onto their website and look at their data and reports. They will all be focused around these two areas, but this is where who's doing the work on, trying to, when you see news articles about number of people who are using marijuana daily, for example, like that's where that is coming from. Census. Census is obviously, the gold standard of data collected, like it's the ultimate survey, right? It's a survey of everybody. Just wanted to mention that one, they have a new interactive dashboard. It used to be called American Fact Finder, and now it is data.census.gov. But they've also very helpfully done a health topics. We'll just go, and also I'll just open it one here. This, really what they're most used for. So you can just see these are the type of health statistics the census is collecting. And really the one that most people see in this field are health insurance data sets. This is how we find out how many people are uninsured and what types of insurance people have. And so this will open in data. You can see, well, I'm going to just do it by, let's see. So you can go to data.census.gov and really just type in, and you can see this is the public health insurance coverage by type. And you can see that this was from 2019, and this is, where people are reporting their coverage is coming from. Is it public health, VA, Medicaid, private plans, et cetera. So usually, almost always when you're seeing health insurance data, it's coming from the census. You can do a lot of data manipulation in data.census.gov that I'm not going to get into today, but you can filter, you can combine, make maps, make tables. If you want more information on playing around with data.census.gov, just let me know. And so then, and when, again, the same thing, when we're talking about global health statistics, you need to be thinking about like who has the ability to collect or aggregate global health statistics. And it's just a very small number of groups. You've got, obviously the World Health Organization, United Nations, you've got the USAID has the Demographic and Health Survey. So these are really the primary global health players. Just wanted to show you that the World Health Organization has the Global Health Observatory. This is where they put all of their data where you can explore. And you can look by country or you can look by indicator. And when you look through the indicators, you can see the type of things that are being collected. And it ranges from first drink before age 14 to dementia. Just look at how long this is. And so when you click on one of them, you can see that let's find one that but yeah, so you can just see that these are like crazy detailed, so life expectancy at birth. If you were to click on this, you can really play around with this data in a lot of different ways. They do visualizations, tables. You can see, global averages. You can filter it by gender. Here it is by country. So you can really play around with the indicators in here. You can also, if you're only interested in a country, like if you wanted to see all of the information we have for Afghanistan, obviously not every variable is going to be collected in every country, but you can see that, these are the things that they have collected for Afghanistan. And it's, there's some tuberculosis and, antenatal care and things. So World Health Organization, this Global Health Observatory is really where you can get access to all of their data in one place. And then the other thing just to bring your attention to is they do an annual report. So this is World Health Statistics 2020, and it, they have a lot of cool visualization to go along with this report. You can see based on, they have it, this is based on continents, but you can really kind of get into the details of this report. This is kind of one of their flagship, this World Health Statistics. This is the visual summary part of it, but you can get into the actual report. Same thing, the United Nations is collecting data. They have the UN data port. If you just were to look at what their health and disability statistics look like, that I do not have, I'll have to fix that link. But you can just, same thing. This is just it's honestly probably some of the same information that we got from World Health Organization, because you can see that, they're, it's, like I said, it's not necessarily the case that the UN is collecting this data, but you can, definitely play around with the UN data in here as well. Like you can see in topics, we could, you can see the type of things that they're collecting here. And, but I would start with World Health Organization before the UN. Also, of course, UNICEF collecting data for about the state of the nation of the world's children. Another great place if you're looking for global data on children. One that you might not be as familiar with is the demographic and health surveys that USAID does. And so they've been doing this for many years, and they do surveys in over 90 countries. So a lot, when you're looking at kind of the sources of things, you'll see they'll refer to like the DHS, that's this demographic health survey. They're on the ground in over 90 countries doing surveys of people on various health topics. I mentioned about, that it's mostly governments doing this work, and there's just a couple people that couple different groups that I wanted to just bring to your attention. The University of Washington has an Institute for Health Metrics and Evaluation, and they have within that the Global Health data exchange. And it has everything from county to global health data. And one of the things that they are pretty famous for is this global burden of disease report that calculates, the burden of disease for countries around the world. Again, they're not collecting data. They're using existing government sources, but they are doing a lot of value added to that data. Same thing, like the Annie E. Casey Foundation has a kids count. They're aggregating all the data sets about children across I'm wondering, this might be a national thing, but across the country, and putting them all in one place. Same thing with America's health rankings. They're taking, we can click on this one. They're just taking the data from the government sources and, applying some metrics to it. And you can see that, they've risk of social isolation right now. We are really high. But you can see that, you can look to see like the source of these. And you'll find that it is, a lot of them are coming from the government sources we talked about. And just a couple more things as we get down into different levels. State data, we already mentioned the state and territorial data from the National Center for Health Statistics. If you were to Google, for example, like Kentucky health data, you're going to find a lot of different things. Like some you're going to get from the state public health department, right? So here is the Kentucky Public Health Data Resource Guide. And what you're going to find from this is that it is all of the surveys that are done at CDC and other government things that are broken out for Kentucky. So, it's not necessarily, there are probably some of these that are done by Kentucky, but most of these are probably coming from the federal government, and they've broken out the Kentucky data from it. So you'll, once again, like no matter kind of where you go, you're going to keep finding the same sources of data. The same thing with, Kaiser Family Foundation does a lot of work on states. And then you're also going to see things like these state level foundations, like Foundation for Healthy Kentucky and Kentucky Health Facts. And these foundations are usually doing more on the ground research. If we look at Foundation for Healthy Kentucky and look at their research, what they're working on right now, you can see that they are, COVID-19 and diabetes. This was a big project that I did last year about obesity prevention in children. So, this is kind of they also had creating a culture of health in Appalachia. This has a lot of good data in it as well. This is one of the examples of a group that is doing work on the ground and not just aggregating kind of the federal government information for their state. So it's always worth, when you're doing, if you were looking in, say, West Virginia, if you were to do Google searches for West Virginia health statistics and see, who pops up, who is showing up in news reports as being a player in this field, you'll start to see the players come out. They come out pretty quickly because there just really aren't that many. They also do Kentucky Health Facts. And, I think that if you were to look, let's see if I can get a county going here. Oh, select a county. I don't know why I'm trying to get Fayette, but, when you look at this, this is a Kentucky vital statistic. So this is stuff that Kentucky is counting and reports up to the national government. And then you can see like this is one of those surveys that CDC does. So, this is just a compilation of a lot of different data sources. So it is always useful. Like one of the most useful things you can do is take a look at the data source, and then you can always follow it to find, see if there's similar data out there. Same things for counties and cities. Like these are all of these sites, except this one we talked about was from the University of Washington. They have county profiles, but these are all groups that aggregate other information for county health rankings and city health. Again, it's really useful just to see like the different ways that they display the data, what they add to it, but they're probably, again, not the original source, but they will tell you who the source is. And just briefly, if you're looking for big data sets that you're going to do the analysis on your own, data.gov is the central clearinghouse for all US federal data. Healthdata.gov is the subset of that for health data. CMS, that's Center for Medicaid. They have all the data for Medicaid and Medicare. And then this last one, ICPSR, this is actually something that you do need a UK login to access. It's free with a link blue. You don't need anything more than that, but it has a lot of large data sets, and most of them, not all of them, but most of them require some statistical software to manipulate it and access it. If you're interested in seeing what's in there and how to get at it, we do have some research guides on ICPSR on the library website. Finally, I really just want to show you this because it's amazing. I couldn't possibly talk about all these things today, but the Partners in Information Access for Public Health Workforce, this is their page on public health resources. And I mean, look at under health data, tools, and statistics, like county and health, demographic, like these all open, bigger lists. And so you can see that, like, look at like state health data and all these different things, getting into, this, like, for example, it's just more specific. This is an alcohol related disease impact, or these are surveys from CDC, chronic disease indicators. But there's just, more than I could ever mention in a presentation at lunch are listed on this page. So I just wanted you guys to have this link because it's worth being able to browse it. And finally, just a couple words about evaluating. I actually made I started thinking about this presentation back in the summer, and one of my notes was, was .gov sites are equal more trustworthy. And I've added a question mark now because, as things like the COVID statistics become really a political football, you might need to think about, whether .gov automatically means trustworthy right now. And so it's really a good lesson that, you should really evaluate the sources of all of your data, not just to see who, what government agency it is, look at the methodology, look at who they're surveying, look at, the data they're collecting and see if it meets your research need. The same thing if you're looking at an organization, we saw things like the Kaiser Family Foundation. If you don't know anything about them, how do you know if their research is any good? So I always start with the About Us section of their website, and then you can also look at who are their funders, what is their stated mission, do they have like a stated political bias? It doesn't mean their research isn't useful, but it's something good to know. An easy way to find out is I do a Google News search for any organization I don't recognize or know a lot about, because one, you'll see like, do they put out a big research report and nobody covers it? Because that might mean they're not, a trustworthy source. Also, a lot of times, with a think tank or a foundation, you'll be reading a news article and they'll say like, the Kaiser Family Foundation, whose mission is to blah, blah, blah. They tell you exactly what it is to give you the context. And finally, I just want to, to say, to be particularly suspicious of data visualization. I think we all kind of know that, like tables and maps and charts, like make sure it's showing what it purports to show. I have two examples here that I think are pretty interesting. This first one is a table that was put out by the state of Georgia earlier in the spring about the number of COVID-19 cases. And if you were just to look at this and you'd be like, wow, cases are going down, like way to go, Georgia. Like, look at this is great. But people started looking more closely at it. And I don't know if you if you can look at the dates across the bottom, they are not in chronological order. Like they're not, it goes from the 28th to the 27th to the 29th to May 1st, April 30th. Like this chart was designed to make it look like the numbers were going down. Also, the counties, which are like a specific color, are not in the same place in each of the days. This is just a really misleading chart, and they admitted that and they corrected it. But if you just, the benefit of data visualization is that, instead of looking at a table full of numbers like this, you look at this and you would be like, yeah, numbers are going down. But you just need to take a look at the details here. The second thing is not a deceiving chart or map, but just that it, depending on what you want to show, a map can show different things. So this has kind of been in the news a lot, like, land doesn't vote, people do. But, if you show this first map of the red counties, you take one, you have a certain conclusion about the election results, versus if you look at this population one with the population bubbles, you get a different idea. And neither one of those is wrong. They're both accurate maps. They just, the choices that people make for digital visualization, for data visualization, can really affect what your takeaway is. So just look, be sure to look at them carefully. Whether it's coming from a news source, a government agency, if you see it on social media, like it's just really important to make sure that it's showing what you think it should show. So that is pretty much what I have planned for this presentation, but I wanted to leave a little time if people had any questions. I don't think any came in during the chat, but I'd be happy to answer any if someone has some. Okay, so I don't think there's any questions, which is fine, but I have a couple more minutes. I'm going to show you one other thing that is actually on the library website. And it is a new database that we added earlier in this year, and it's called Statista. It is a database of statistics, just like it sounds like, and it's really easy to use. And one of the, I think the best ways to use it is just to see who they cite, because then it takes you to directly to the report, or, oh, that does not. Okay, well, I'm being thwarted in my in my attempts here, but basically it has just a search bar, and you can type in like opioids, and it will pull up a list of statistical things about opioid epidemic, and you can see the sources and things. It also has what they call the dossier, which is where they compile all of the statistics they have in one place, and they're all done with colorful charts, and you can save the charts into PowerPoint or Excel or PDF, and you can manipulate them. And so it's just a really great source if you're looking for anything. I bought it kind of for business students, but it's really being used across campus because everybody is looking for statistics on whatever they're studying. So just something to be aware of as a new resource we have here at the UK. So if there one last chance for questions, and I'll let you get back to what's left of your lunch hour.